Malaria, we won't let you steal from us anymore. We are the generation that can end malaria.
Malaria, we are too strong for you.
We're too bold for you.
Malaria, we are too fast for you.
Malaria, I don't like you.
Too fierce.
Too smart for you.
Malaria, don't even dare take our future with you.
Malaria, you can't stop us.
Nothing will keep these lines from growing. We are the generation that can end malaria.
It's time to take our future back.
This is Chwele Sub-County Hospital in Bungoma County. It is important that services remain accessible to clients around the clock at the maternity wing of such facilities. This would only be possible if they are guaranteed uninterrupted power supply. Unfortunately, power outage is a common occurrence in Bungoma County as a result of the deficiency in the national grid, which is the main source of power for institutions and facilities. For the many maternal health facilities that do not have the backup of a generator, life simply stops with a power blackout.
Some way back in 2015, before the solar was put up, we had a blackout and then our mother was in labor. Then the mother had a difficult delivery, but because the baby had come out and it was flat, that is, was not breathing well. So we were not able to resuscitate. We tried, but it was because of darkness, we couldn't do a lot. So the baby passed on. So we were very distressed.
Access to maternal health care is a right protected by the Kenyan Constitution and is a key component of the Sustainable Development Goals. To ensure that women can still enjoy this right even when power supply by the national grid falls short, the Maternal and Newborn Improvement Project, MANI, has installed solar panels in 33 health facilities in Bungoma County, totaling 57.5 kilowatt power, and provided 13 health facilities with water heating capacity totaling 3,500 liters.
In early 2016, we carried out an energy audit in 60 health facilities in the county. The facilities were experiencing the grid power outages lasting up to 6 to 10 hours, 3 times a week. That means that services would just discontinue for that period. You'll also find out that the maternal mortalities and infant mortality rates at that period were very high, and same as referrals for complications.
Today, whenever there is interruption in the main power supply, service provision goes on in many maternal facilities in the county, thanks to the facelift.
As she pushed, we no longer lose babies because the incubators are on 24/7. We have a KP fridge where we keep our vaccines. Nowadays, We no longer have problems of vaccines losing potency. They're always potent, and then our children are able to be given the immunization and they're protected against diseases. This soil, again, it has assisted us. The mothers could give birth, but they used not to birth because the water was cold, but now they can do it comfortably because they can get hot water, warm water.
We appreciate the partnership we've had with Bungoma County in this program, and we're happy that the results are already being felt at the county level.
We want to lower to zero the number of deaths as mothers give birth. Money has been able to assist us do it.
Yes, that is good.
xaaladda iminka iyo xaaladda hore iska mid maaha. dargii hore hooyooyinku guriga iskaga dhali jireen oo ku dhiigbixi jireen. waxaan dhahdaa may haysan dhakhaatiir tababaran oo fiican, may haysan adeeg caafimaad, gurigoogii ku dhiigbixi jireen. kasoo ku baabijirta dantoo isku goy jirtay, dantoo inta umushuun bay dhiman jirtay dhiigbax.
One of the challenges that the country is experiencing is that it is very difficult to place and retain medical doctors in some of the rural areas. So many of the times when the pregnant mothers come to the hospitals, there are no qualified people to attend to them, and that puts their life at risk. So that is why at THET, together with the Ministry of Health, we said that if we are having a challenge placing doctors in the rural areas, why don't we train nurses to be able to perform some of the functions that doctors are playing, so that at the end of the day, these nurses who have acquired additional skills in cesarean section, in resuscitation, but also anesthesia, can be able to, within those skills, be able to intervene to help our mothers who are out there in the villages.
waxa weey trainingkii iminkaan soo qaadanay wuxuu naga caawiyaa wax fara badan oo aan markii hore garanay. laakiin waqtigan xaggaasna waxaanu helay practical fara badan, waxaan helay cases fara badan oo isugu jira waxa weey case medical ah, waxaan helay case operation loo sameynayo, case decision maker oo waxa weey go'aan laga qaadanayo. case fara badan baan helay. case tusaalahaan oo kale waqtiga intaa waxa weey waxaan la kulnay hooyooyin fara badan oo kula kulnay maxay dhakhtarka lexdiisa, hooyooyin fara badan oo ilaa iyo waxaan oran karaa maxay ahaayeen ilaa iyo 20 case malaha oo refer gareeyay oo waxa weey ZS ka noqdeen in fara badan oo ilaa iyo hooyooyinka bishii bil walba ku dhashay konton hooyo ku dhalaa halkani kontonka hooyo ku dhalaa waxa weey dhakhtarkan waxa weey 20 kamid waxa noqdaan complicated ba noqdaan.
aan joogay gurigeyga inanteeda yar kala uurkeeda yeeshay dabitana sidii baxraanada la xiriiray سعيد بياجي مركي أفوش حنان بتجي مركي سعيد ياجي وعيش ياجينا قليل هاي أمبلاس كذا يقاضي ورقتي بسعيد يقرأي أمبلاس كذا يقاضي ببران تجي حياجي الدكتور خليل مركي ياجي يقاضينا قليل هاي سيدو قليل بيقسمي ويقالي أنت هربي قصة سهري سيدي من قراري لكن يمكن دكاتير فجبت على صوتك البري في على نجا سعيد بن نشوجا دائما هذه قاعدة تختلف في عميان مركا حتى مقارنة إذا كم تشرا واحد بحي واحد معلطانا.
The issue is that the doctors are not there. So what do we do? Do we leave the mothers to die and wait for the doctors to come in 10 years' time, or do we do something now to be able to save on the life which is at risk?
This is Maya, crying. Her first cry ever. For Maya's mother, it's the best cry ever. Because that's the sound every mother hears when her baby is born healthy. It took a lot of work to make Maya cry. It took soap, 1 bar of soap, to wash the hands of a trained health worker. It took a trained health worker to staff a local clinic. It took a local clinic to provide affordable prenatal care to Maya's mother. It took Maya's mother to plan for a healthy baby by sleeping under a bed net, taking vitamins, eating nutritious foods, and receiving vaccines. It took vaccines traveling to the clinic in a refrigerated truck. It took a lot to make Maya cry. But it wasn't just the clinic, it wasn't just the vitamins, or the nutritious foods, or the bed net, or the vaccines. It wasn't even the bar of soap. It was all of these pieces working together in a system, a health system, to deliver Maya into the hands of a trained health worker who helped her take her first breath and cry. Her first healthy, beautiful cry. So yeah, it's not easy to make a baby cry, but it's worth it. It's worth it to ensure that supplies move from the storage room in the city to the exam room in the country. It's worth it to make a hospital there into a clinic here. It's worth it to provide skilled care so that expecting mothers become excited mothers. And most of all, it's worth it to turn the sound of one crying baby into the sound of millions of crying babies. Millions of crying babies. That's the sound of knowledge, of resources, of people all working together to bring a good health system to life. Health systems create healthy futures where every baby grows up strong, goes to school, thrives, and makes their village, country, world a better place.
It is so decided.
In 2015, world leaders committed to universal health coverage as part of the United Nations Sustainable Development Goals. Achieving universal health coverage means everyone, everywhere, can receive the quality health services they need across the life course without facing financial hardship. The 2021 Universal Health Coverage Global Monitoring Report reveals that before COVID-19 struck, only around 2/3 of the world's population had access to health services. But not all those people could afford them. In fact, almost 1 billion people were spending more than 10% of their household budget on health, and 500 million people were being pushed or further pushed into extreme poverty. And COVID-19 is making the situation more precarious. By both halting the progress the world had made in increasing service coverage and worsening financial hardship for people seeking healthcare, particularly among disadvantaged populations. We must act now to stop this. This means investing in equitable and resilient primary healthcare-oriented systems, enacting policies to prioritize making high-quality and affordable healthcare accessible to everyone, everywhere, especially the most vulnerable, and boosting domestic resources to increase public spending on health and reallocating spending towards primary healthcare. To reach the Sustainable Development Goals of universal health coverage by 2030, we will need a collaborative, targeted, and accelerated effort building on strong data and evidence. And most of all, we will need strong political leadership. Universal health coverage is a political choice, and it's one of the most important choices to be made.
Good morning, everybody, and welcome. Can I just get a sound check? John, I can see you. Can you hear me? Fabulous. We're off. What a wonderful set of videos. Thanks so much for those who prepared those, and a great reminder that what we do, the little things we contribute every day, helping with that goal of making the world a better place. I'm Darren Welsh. For those who don't know me, I'm Director for Global Health here at the Foreign, Commonwealth and Development Office, and it's a huge pleasure to welcome you all to today's launch event and to be co-hosting this event with our friends and colleagues at Action for Global Health. I'm delighted to see that we have got a very wide range of representation on today's event. We've got our civil society partners, we have colleagues from international organisations, we have our academic partners and donors, and of course we're joined by our Minister, the Honourable Wendy Morton, who I can see on the camera as well. Good morning to you, Minister, and you'll be giving a keynote address for us later on, which we're eagerly looking forward to. So thank you for coming and finding time to join us this morning. These papers that we are launching are really important. This is a big moment for us. And I know some of you might have liked to see them a bit sooner. You've been waiting for them for a little while. But I want to thank you all for the contributions you've made, for the challenge you've given us as we've worked through a difficult pandemic time to bring these papers to fruition, and also to thank the team for all the hard work they've put into a couple of really cracking products we're about to launch upon the world today. In the middle of the pandemic, I think these papers do a really important job in that they provide a longer term perspective and they set some strategic direction for us. They are informed by the pandemic, but they look beyond it. On ending preventable deaths, we're setting out a clear FCDO commitment to this important agenda and a plan to work differently to get more out of our investments and our partnerships. And you'll see in the paper actions that speak to our values, reaching the most marginalised, partnerships with grassroots organisations, giving people voice. And alongside that is a more comprehensive approach, bringing together our diplomacy with our development expertise and our resources into a new package, a new UK offer on this agenda, but also addressing not just the direct health elements, but looking at the wider things in people's lives which impact on their health outcomes. And running through it all, of course, you'll see a strong thread of science, innovation and research as key components. And similar factors underlie our approach to health systems strengthening too. But there we also deal with sustainable financing, quality of care, and the interaction between our own workforce, our recruitment here in the UK, and capability overseas. But we'll hear more about all of that later on. For now, I just need to introduce our colleague Ben Sims from Action for Global Health, but also CEO, of course, of the Tropical Health and Education Trust, who will tell us a bit more about today's event. Ben, over to you.
Thank you so much, Darren, and to FCDO colleagues for inviting us to launch these two papers. Action for Global Health is delighted to be partnering Minister Morton and your colleagues on the launch of what we too see as enormously important papers. For those of you who do not know, Action for Global Health is a UK-based network of more than 50 organisations working collaboratively towards a world where the universal right to healthcare can be achieved. I'm the CEO, one of the member organisations, FET, as Darren has said. Just a few housekeeping points, if I may. If you're not, please remain on mute if you're not speaking, if you're not invited to speak. When you put your questions in the chat box, please also put your name and the organisation so that we know where the questions are coming from. And please use the hashtag for this event and get active on Twitter. The hashtag is very simple. It's hashtag health for all. From the outset, I want to say we warmly welcome these papers and we congratulate Minister Morton and FCDO colleagues on the work and thinking reflected in them. The world is facing an unprecedented challenge, as the papers acknowledge. This is reflected in health outcomes. To give one example from the paper, recent figures from 18 low-income countries suggest there are 2.6 maternal and child deaths for every official COVID-19 death. That is the scale of the devastation, disruption to health services that we're seeing. And it's reflected in unprecedented pressure being experienced by health workers in this International Year of the Health and Social Care Worker. WHO has recorded some 115,000 health workers have died as a result of COVID-19. But we're also seeing unprecedented levels of people departing the healthcare professions or falling absent because of work-related stress. Both here, I have to say, in the UK and overseas. It's a shared challenge. And this is the context, of course, for the papers. The papers have many things to commend them. They provide welcome emphasis on country leadership, strong, resilient health systems and gender equality and human rights as the cornerstone to end preventable deaths and ensure the universal right to health. The papers emphasize the importance of advancing the rights of marginalized groups. There is, however, another context in which these papers are launched, which needs to be acknowledged, and it was described by the WHO Director General in the build-up to UHC Day, which we marked on Sunday. And it's a crisis of solidarity. The fact that COVID-19 has exposed fundamental weaknesses, in his words, in the global health architecture. We have to acknowledge at a meeting like this the inequitable availability of vaccines, and we have to acknowledge the recent impact of cuts to UK ODA, something I know Minister Morton will be doing. The papers provide a roadmap for UK engagement. Across both papers, there is a celebration of the expertise in health available in the UK, both domestically and across the 4 nations, perhaps best expressed in the NHS, but also globally in the form of NGOs, academia, commerce and science. This UK track record and experience in health is a golden thread running through both documents. As such, the papers point to the potential of what can be achieved through a globally engaged United Kingdom. It is inevitably the view of Action for Global Health members that this potential will not be realised until we see a return to 0.7 and until we fully commit to bringing alive the forms of global solidarity called for by Dr. Tedros. Nonetheless, be in no doubt, these papers make for excellent reading, and I would like to extend the congratulations of the Action for Global Health Network to Minister Morton and to FCDO colleagues, and to thank her for her personal championing of the things expressed in these papers. In taking forward her responsibilities for global health within her broader portfolio of responsibilities as a minister in the FCDO, Minister Morton has become a friend to many of us in this sector. This is the latest step along that road. It is therefore my very great pleasure to be able to invite Minister Morton to say a few words and to thank her.
Thank you, Ben, and thank you, Darren, as well, and thank you everyone for joining us this morning, particularly given it's so close to the festive season. So I really appreciate you finding time in what I know are busy diaries. I'm also really sorry that we can't meet in person, but I think we all understand why it's important that we gather online this morning. But I'm grateful to our co-hosts, to Action for Global Health, and to all those who are speaking today, and I really look forward to our discussion later. 2 days ago, we marked Universal Health Coverage Day, and there are few goals as challenging or as important as this vision of health for all by 2030. And today, I'm proud to launch 2 new government papers. The first sets out a clear pathway towards stronger health systems. The second is a roadmap for cutting the toll of preventable deaths of mothers, babies and children. Before the COVID-19 pandemic, we were making significant progress on both of these goals. In 3 years from 2015, we saved an estimated 1.5 million lives through vaccines for 74 million children. In 2019, through the Global Fund, we provided life-saving medicine for more than 700,000 HIV-positive mothers. From 2011, we trained more than 93,000 health workers in 8 years across 30 countries. But despite this progress, even before the pandemic, 8 million people were still dying from preventable conditions every year. That means that a pregnant woman, baby or child was losing their life every 6 seconds. The impacts of climate change were already hitting some of the world's most vulnerable people hard and increasing the death toll. Then COVID-19 engulfed the world and further darkened this already terrible picture. For mothers, babies, children, people with disabilities, LGBTQ+ communities, they all lost access to life-saving healthcare, and often their livelihoods too, as lockdowns and economic shocks hit. Key services like childhood immunisation and malaria prevention have begun to bounce back, but preventable maternal and child health have not only continued, but they have increased. Recent figures from 18 low-income countries suggest that for every official COVID death, there have been at least 2 excess deaths amongst mothers and children. And the tragedy is that if health systems had been stronger and more inclusive, many of those deaths could have been prevented. And that's why the approaches that are set out in these 2 new position papers are vital to our work on global health. And there is a simple message at the heart of our health system strengthening paper. We must take a whole system approach. Through our investments and diplomatic efforts, we will focus on building overall capacity from policy through to delivery. That means strong primary and community health clinics staffed by skilled, motivated workers and robust supply chains. Because of course the same healthcare as a health worker, it's the same health worker that vaccinates a child against measles and an elderly person against COVID-19. That same supply chain ensures that essential vaccines, drugs and nutritional supplements reach those in need. And along with this, equal access to good quality care is fundamental. And so too are systems that are strong enough to withstand climate change. Alongside our health systems paper is our new approach towards ending the preventable deaths of mothers, babies and children. Naturally, building stronger health systems is the first pillar of this. But we can't save lives without an eye on the bigger picture for women and girls. Unless women have equal rights and control over their bodies, we cannot end preventable deaths. And this is why equality and empowerment, with a focus on sexual and reproductive health, makes up our second pillar. The third is about protecting the health of women, babies and children through a focus on healthier lives and safer environments. With sustainable nutritious diets and ready access to clean water and adequate sanitation, and by protecting them from harmful air pollution. Last but not least, our fourth pillar supports pioneering new approaches and discoveries, and this we know can save millions of lives. The UK has been at the forefront of science and research. From John Snow's discovery of how cholera spreads back in the 1850s to our recent funding for the discovery of new malaria treatments. And this is why we will focus on supporting research into new medicines and innovation in diagnostics and service delivery. But of course, we cannot achieve everything alone. Partnership, staying the course are themes that run through both of our approach papers, and I strongly believe in this. This means being a partner when it is hard and staying the course for the long term, including in some of the most fragile countries. We must get behind national leadership, helping to strengthen countries' own systems in the way that they want. And here at the Foreign, Commonwealth and Development Office, we will work closely with other government departments. And of course, we will draw on our strong links with you, our expert partners across civil society, business, research and academia. And this is how we will use our expertise in health, diplomacy, science and development to the max. This is how we will make progress towards our sustainable development goals and ensure that no one is left behind. Now, I know many of you will ask, how will we do this, given the financial constraints that we face? And the impact of the pandemic really forced us to take some very tough but necessary decisions last year. And these have impacted on many of you, our partners, directly. They've required you to adapt and be flexible, often in ways that I know are uncomfortable. So let me thank you all for working with us through this challenging period. But improving economic forecasts show that we may meet the test set by the Chancellor to return to 0.7% in the final year of this spending review in 2024-25. But meanwhile, these papers show that we remain committed to strengthening health systems and ending preventable deaths. But the scale of the challenge is undeniable. However, together we are strong and together we can make an impact. And I really look forward to continuing our partnership and the progress that we will make together. Thank you all.
Thank you, Minister, very much indeed. I think I'm going to carry away that phrase, being a partner when it's hard, because it is hard, isn't it, for people in the UK, but also very much for people overseas. and we need that partnership that you describe. So thank you so much, and I know you're staying and you'll be able to contribute to the panel discussion later on. But I'm going to introduce the first two panelists and then hand back to Darren, if I may. I'm very pleased we're joined by Hope Mibuthi, who is a trustee of Plan International, UK, and a student at the University of Nairobi, pursuing a Bachelor of Laws. She is also a youth talk show host on Hope TV and has been involved in advocacy from the age of 12, starting from the then Kenya Children's Assembly, serving in various roles and championing children's rights. She became a Plan International Kenya Girl Advocate in 2015. And then we're also joined by Professor Sophie Witter, who is the Professor of International Financing and Health Systems at the Institute for Global Health and Development at Queen Margaret University. Sophie is a health economist specializing in health financing policy and health systems research in low and middle income countries, with 30 years experience, something I never confessed to. Darren, over to you.
Thanks, Ben. Yes, it's my pleasure to introduce our second two panelists. From the private sector, we have Rebecca Marmot, and Rebecca is Chief Sustainability Officer at Unilever, working on Unilever's contribution to a sustainable future. Prior to this, Rebecca was the Global Vice President at Unilever, overseeing their global advocacy, policy, partnerships and sustainability work. And of course, Unilever has for many years been a key private sector partner for the FCDO, including recently work we've done together on behaviour change, sanitation and hygiene with communities in the COVID-19 response. And then our last panellist, last but by no means least, is our own Dr. Chris Lewis, who's a much cherished and valued colleague with a long and distinguished career. He's our head of profession for health at the FCDO and has previously led DFID Nigeria's health, nutrition and WASH portfolio. He worked to establish the £1 billion Ross Fund for R&D with our health research team, and he initiated the UK's Ebola response in Sierra Leone when that crisis struck, and many other things besides, but I will stop there. So I think now we move to the panel. Has Hope been able to join? I think there was some technical hitch with Hope.
I think not, Darren. I think it's Sophie we need to go to first.
Is that right? Fabulous, flexible as ever. Thank you so much, Sophie. Perhaps we could go then to you first, Sophie.
Great, thank you very much. So I'm proud of my 30 years, no problem with that. So really, yes, thank you very much for inviting me. So just to say, first of all, health systems are the backbone. They're the hardware and the software behind the delivery of all services. So not strengthening them is clearly not an option. Without strong health systems, ending preventable deaths and moving towards universal health coverage, as well as ensuring global health security, are all impossible to deliver and sustain. The evidence base for health system strengthening and its importance is considerable, though there remain important gaps to fill. We know that well-designed interventions improve quality of care, save lives, and improve responsiveness and financial protection. There's good evidence, for example, for engaging communities with health structures through social accountability processes, for leadership development interventions, for well-designed performance management for staff and task shifting, and for more pooled and universal health financing from domestic and external sources. We also know there's good evidence for strengthening primary health care, including community health worker-based models with strong referral systems, and for integration of services, especially for mothers and children. The UK has been at the forefront of work on health systems, both in terms of investment, but also in developing the knowledge base to drive our work forward. We have a record to be proud of, and we need to continue to be at the forefront of thought and action in this area. And this record has been achieved by means which are worth reiterating as they remain critical today. By setting clear priorities focused on poverty and equity, by working closely with national and country stakeholders. Also by working in areas where needs are greatest, including fragile and conflict-affected settings. And by leveraging our support to international organisations to improve collaboration on these priorities. And finally, by funding and using evidence. So the Health System Strengthening Position Paper articulates the priorities well, and I just wanted to highlight a few key points. First, in health system strengthening, no investment works unless you start from the perspective of the communities and the national organisations that make up the health system, seeing the world from their eyes, understand the resources that they bring and the challenges they face, and what actions can make the change for them. And that's why in our research we work with partners embedded in local health systems, and we benefit from UK funding through the research programme consortium model, which allows us to build long-term relationships which can develop capacity, trust and results. Secondly, we need to clearly articulate the qualities that define a strong health system. For example, its capacity to create spaces for dialogue and learning, its culture of solidarity, and then to work with partners to realise these. Thirdly, health system strengthening has to be context specific, and in some settings facing shocks and crises, including climate change related, supporting health systems, even preventing their collapse, may be appropriate. Many parts of the world are facing complex emergencies, and we need to be able to bring together the development and humanitarian actors and approaches. Fourthly, I think as was highlighted, we've been successful in increasing coverages with core service across the world, but we do need to expand our focus on neglected services such as non-communicable disease and mental health, and to understand and address the many equity and gender barriers to using them. Our data for tracking universal health coverage also needs to be improved. The focus on equity is still not strong enough. For that financial protection, for example, the non-users are not well represented in the data at present. And working in this way also takes considerable technical but also political skills, and that's always been an area of strength for DFID and now for FCDO, as well as for researchers working in applied health systems research, such as in Rebuild. For example, it means taking on the interests of different stakeholders, including external organisations, which are often a source of fragmentation in lower income settings. Finally, it takes resources and political commitment, an area where the UK has been a leader in the past and will, we hope, continue to lead in future. Thank you.
Thank you so much, Sophie. Minister, may I turn to you and ask you a question? As Sophie has described, strengthening health systems is fundamental, but it's complex and it can be hard to evaluate. What are your thoughts around this, please?
Thank you, Ben. Well, first of all, Sophie, let me say thank you, because I think the overview that you gave us just now was absolutely excellent. But what I am really struck by is just how complex health system strengthening can be. And that's why the evidence that you've spoken about is absolutely critical for us to continue learning. And when I say about learning, that's about how to go beyond supporting systems and actually move towards strengthening them. And I understand from my team that you are working in partnership with other researchers and experts on how to evaluate our efforts on strengthening health systems. And this is going to be really important, not only to guide us in terms of what we do, but equally important to help us to tell the story of how strengthening systems is actually helping to make the world a better place.
Thank you, Minister. Thank you, Ben. I think Hope is still trying to join us, so we are optimistic that she will be able to dial in, and we'll bring her in as soon as we can. But in the meantime, then, it gives me great pleasure to invite Rebecca to speak to us and give us her reflections on the healthier lives and safer environments components of the plans and the role that the private sector has to play. And we know the private sector, of course, plays a critical role in providing health services in many, many parts of the world. So, Rebecca, over to you.
Thanks very much, Darren. Good morning, Minister. Good morning, everybody. Thanks so much for inviting me and on behalf of Unilever, us to say a few words today. So Unilever is one of the world's largest consumer goods companies. We're known for making great products. We have a huge global footprint and a big belief in doing business in the right way, putting sustainability at the core of what we're doing. So we're available in about 190 countries now, and we're used by 2.5 billion people every day. So that global reach gives us a unique position to impact the lives of people everywhere, but it's also a big responsibility. We know that to have a healthy society and a healthy planet, we can contribute by having a healthy business, which is why we've put making sustainable living commonplace. And all of the work that we're doing in that space is aligned with the SDGs. So access to clean water, sanitation and hygiene plays a central role, as you all know, in ending preventable deaths. Our hygiene brands have been working on this for decades, ever since we were founded in the north of England back in the late 19th century with the mission of making cleanliness commonplace. Since 2010, our soap brand Lifebuoy has reached more than 1 billion people through their hand washing behaviour change programmes, and through brands like Domestos, we've been working with UNICEF to fight the war on poor sanitation. We've reached about 30 million people now in India with access to clean, safe toilets, working with Prime Minister Modi on the Swachh Bharat campaign. By 2030, we want to improve the health and well-being of 1 billion people every year. So achieving the SDG goals isn't just a target for us or for the world, but we really realise we can make a tangible contribution by really helping to save real lives. You've heard the stats today. We know that every day 800 children die from hygiene-related preventable causes. Illness and poor sanitation in schools is really impacting children's education and their futures. Particularly, we know that has a disproportionate impact on girls, and especially then when you put a COVID lens on top of that. And we hear all the time about girls dropping out of school or missing school when they lack access to a clean toilet with privacy. So SDG 17 calls for greater collaboration to tackle these big global challenges. And we all know, and I think there's a shared belief on this call, that the solution isn't just about governments or just about business, just about NGOs and the UN agencies. Actually, you need to have business and all of those different stakeholders working together. So back at the end or middle, I should say, of 2020, when the pandemic was really raging around the world at the beginning, we stepped up together with the UK government, partnering with the FCDO to create what was called the Hygiene and Behaviour Change Coalition. I think it's a great example of showing how public-private partnerships can really tackle with speed and at scale some of these issues that we've heard about this morning, key to ending preventable deaths. So we also involved our academic partner, the London School of Hygiene and Tropical Medicine, and there were 21 different UN agencies and NGO partners. And together now we've reached 1.2 billion people with hygiene and COVID-19 awareness messages. So millions reached through behaviour change interventions, through hygiene products, hand washing infrastructure being set up in healthcare centres, in schools, in communities and in homes. Unilever gave 78 million different hygiene products. We helped to train 260,000 frontline workers on COVID prevention and safe hygiene behaviours. I think what was interesting is when you look at the breadth of the different kinds of work that we did together with FCDO and some of the partners. So, for example, with WaterAid, we really focused on the inclusivity agenda. So putting in place hand washing facilities that can be adapted to be used by people with different sorts of abilities. So, for example, they can be operated by pedals using hands or feet or knees. So hands-free operation of the stations. ActionAid in Kenya really focused on taking a gendered approach, putting a lens on how to particularly target working with women and girls. UNHCR trained refugees in South Sudan and the DRC as community health workers to deliver hygiene awareness messages in their camps. PSI in Kenya and Vietnam developed chatbots to deliver COVID-19 training to healthcare workers via WhatsApp, because of course a lot of the normal ways of training and interaction were restricted by not being able to meet face to face. We worked together with the Sesame Street workshop to adapt behaviour change materials to make them accessible to children and their carers through messages coming from really well-known Sesame Street characters. So if we're to meet the SDGs by 2030, I think that sort of example demonstrates the power of everybody stepping up whether it's on health system strengthening, battling hunger, improving access to wash, or accelerating gender equality. As an example, to achieve access to clean water, hygiene and sanitation by 2030, our efforts need to be quadrupled. So we're trying to do our bit. We've set our own target at Unilever, as I mentioned earlier, to improve the health and well-being of 1 billion people every year. And it's great to see the UK government stepping up as well and showing real leadership, playing such a pivotal role in COVAX. So we know that we can't be a sustainable business in an unsustainable world. That's why we're trying to partner with others to unlock these systemic barriers and drive systems change at a macro level. Last month, for example, we partnered with the UK government as a principal partner at the COP to bring together the private sector in terms of being able to communicate on behaviour change around trying to live a more sustainable life. And the same rationale holds true for ending preventable deaths and strengthening health systems. We need local and national governments to invest in infrastructure, strengthen social protection policies, and make sure everyone has access to the foundations of a healthy and productive life: water, sanitation, hygiene, nutritious food, healthcare and education. And then the private sector to partner to help to deploy those programmes for sustained long-term impact. Thanks very much.
Thank you, Rebecca, for that, and for bringing out so clearly the power of partnership, how we all need to work more effectively together. That reach you set out is truly astonishing. I expect most of us wouldn't have to wander very far to find one of your products, but that ability you talk about to work in partnership to bring innovation in products and services, really powerful, I thought, and the challenge you bring to us who work in government too is really appreciated. Minister, perhaps I could turn to you and just ask for some reflections on those remarks, and from your perspective, what do you think the UK gained from that partnership that we struck with Unilever over the recent months of the pandemic?
Thank you, Darren. I actually think we gained a lot, and personally I really enjoyed learning more about this particular programme that we were working together on. But I think, other than reaching over 1 billion people with essential information and advice on hand washing, I think there are probably 3 things that spring to mind. Firstly, it was a brilliant example of how government, a major company and NGOs can come together and collaborate to deliver a truly global programme, and to do this in an incredibly short time frame. And so I think, hats off to Unilever here, Darren, who really, got everything set up and managed. I think it's over a dozen contracts with our NGO partners. So that was the first thing. I think secondly, I think it's fair to say we've learned a huge amount from innovation in low-cost hand washing devices to using social media as a means to communicate hygiene behaviour. And I think these are lessons that are now being shared as part of a major learning exercise. And thirdly, finally, I'd like to just take this opportunity to also highlight the key role that was played by the Hygiene Hub, which was set up by the London School of Hygiene and Tropical Medicine, not just in terms of sharing best practice, but also for providing the scientific advice on how to design an effective behaviour change programme. So I think overall, what this showed me really is the breadth of work that we were undertaking. But actually how, and you used the word, I think, Darren, in your question to me, that it was of how the hand washing and behaviour change programme was incredible. But it was an incredible example of what we can achieve when we pull together and when we work together. That would be one of the key messages that I would take away from it.
Thank you, Minister. I took from that was speed, innovation, and the use of media. All things we can perhaps learn a bit more about from our private sector colleagues. So thank you for that. Ben, I think I hand back to you now.
Thank you, Minister. Thank you, Darren. Yes, delight to introduce now Dr. Chris Lewis, Chris, thank you for agreeing to discuss preventable deaths and health systems paper from the perspective of the country office. So from the perspective of our partners in humanitarian and fragile contexts. Over to you, Chris.
Thank you, Ben, Darren. So Minister Morton and friends and colleagues, and this is a time of immense challenges and opportunities. Opportunities as we've brought together the respective strengths of the diplomatic levers and geographic footprint of FCDO and the development, financing and health capability that DFID had. And as we bring these together under FCDO, opportunities as we establish a new global health directorate under Darren Welsh. But alongside that, the immense challenges of the global pandemic, which is affecting all of our professional and personal lives. But we know the potential opportunities that can arise out of crisis. We don't, and with Omicron, the threat of renewed waves of global transmission that have the potential to overwhelm vulnerable health systems has become all too real again. And it's important that we do all we can in the coming months to enable the health systems, particularly of vulnerable countries, to do all they can to be as resilient as possible to prepare for this impending crisis, and particularly amongst the most vulnerable populations. However, as with other areas of public health, it's important that we get the right balance between the vertical focus of taking rapid action on COVID-19 and the horizontal approach of looking beyond COVID-19, taking that wider approach, looking at the range of other burdens that are affecting countries, the wider range of indirect impacts of COVID, including health, economic, gender, WASH, food systems, nutrition, secondary crisis, and many more. And strong health systems are critical to this. They're the foundation for our work on global health security, including responding to COVID, whether that's disease surveillance, behaviour change, as we've heard, vaccinations, financing, the health workers that are treating patients with severe complications, and many other areas. But these are the same health systems that deliver the critical essential services that can prevent the deaths of mothers, babies, and children. With health systems, you don't need to choose one intervention when investing in health systems. It's a bit like a buy one, get one free deal, except it's a sort of buy one, get multiple interventions. And I've seen the very real need for us to focus on ending preventable deaths of mothers, babies, and children. And I think we may just have someone who's just come in on mute. I don't know if John is able to look at this, but I've seen the importance of us focusing on mothers, babies, and children. I've spent a number of years in some of the most vulnerable settings, such as South Sudan, and seen that the most vulnerable people in the poorest countries experience the greatest impact of preventable deaths, of deaths that could have been preventable. More than 9 out of 10 of all maternal deaths occur in the world's poorest countries. It's a critical issue for women and girls in these countries. Etched into my memory is the woman that died of an obstructed labour, as I cared for her despite everything I could do. The malnourished child that died in front of me from pneumonia, despite the treatment I provided. These deaths were preventable, and they're a personal sadness to me. They're something I carry with me, and they're an absolute tragedy for their families. The numbers of preventable deaths unfortunately become so large that they start to lack meaning. 5.5 million women, newborn babies, and children dying each year. Now that's 5.5 million individual tragedies, and many of these deaths aren't complicated or costly to prevent. A death can be prevented through a skilled birth attendant managing a mother's labour, a baby being breastfed, a child having access to safe water supply. So what can we do about this? And it's great to see the publication of these papers. It's the first ever health system strengthening paper. The EPD paper is the first time we've laid out a multi-sector, multifaceted approach to this central issue, looking at the key drivers as well as the direct causes. But it's not these papers that will save the lives. It's the action we take based on these papers that'll have the impact. We need collaboration, coherence, and commitment. We need collaboration to continue to work closely with everyone on this call, valuing the collaboration and partnership. We need to work with parliamentarians, civil society, private sector, academia, other funders, international partners, working across HMG in a unified effort. And we need coherence. We need to bring our levers together, whether that's our diplomacy, our technical assistance, our financing. And we need to work coherence between sectors, between many of the sectors we've heard about, whether that's health, nutrition, wash, food systems, vertical diseases, with focusing on areas with our horizontal health systems approach, and coherence between our bilateral, our multilateral, our research work, with greater synergies between these mechanisms. And it's commitment. This is about a renewed commitment to deliver on these fundamental areas of public health, health systems, and preventing deaths of mothers, babies, and children. It's about coming together to focus on a common goal. So I know the production of these papers may have felt like a long journey to some of you, whether that was writing them or waiting for them. But actually, this is the start of the journey. This is the start of the conversation. And actually, it's moving on to the most challenging chapter of implementing the ambition that we've written down. So let's commit together to work towards ending the preventable deaths of mothers, babies, and children. Thank you.
Thank you very much, Chris. I think we've now managed to bring a colleague online who will be able to give the remarks I hope that was going to deliver. Not Hope herself, but I think, do we have Rose Caldwell, CEO of Plan? What's that?
Sorry, Darren, not yet. Let me give me 2 seconds and I'll bring her back.
Brilliant. We're just bringing in Rose, flexible as ever. Thank you, John, for your help and support. And then afterwards, we're going to go to the Q&A session. So perhaps I can encourage you. I know there are some questions coming in. If I can encourage you to like the ones that you would particularly like us to address, and to put any comments or questions that you may have. We'll try and pick them up when we move to that next part of the agenda.
Okay, Darren, just call in Rose now.
Marvellous. What a shame Hope wasn't able to join, but these things happen, don't they? I can see a number on screen. Rose, is that you?
Hello, yeah.
Welcome. We can hear you. Thank you so much for joining us and for stepping in. I'm sure you're known to most colleagues here, but Rose, perhaps you'd just like to introduce yourself, and then, if you will, be kind enough to make the remark. So we know that your trustee Hope was hoping to deliver. Unfortunately, it's been thwarted by technical issues. Over to you, Rose.
Okay, well, thank you very much. And I'm a poor replacement for Hope, unfortunately, but I'm afraid that's all technology will allow today. So my name is Rose Caldwell. I'm the CEO of Plan International UK. And I know many on the call will know that Plan International is an international NGO that works for children's rights and particularly equality for girls. So first of all, thank you for the opportunity, Minister Morton, and for the invitation to join today's panel on this important topic. And it is really fantastic to hear the commitment of the UK government to ending preventable deaths of mothers, babies and children by 2030, and of course to supporting health system strengthening. Such incredibly important priority areas towards realising everybody's right to good health and well-being. Complications during pregnancy and childbirth are the leading cause of death for adolescent girls globally. The causes and solutions to this are complex, but we do know how to address them. About half of the 9.5 million pregnancies experienced by adolescent girls each year are unintended, driven by lack of information and access to services. 14 million girls have an unmet need for modern contraception, making them the cohort with by far the highest unmet need. These gaps are often greater for marginalised girls, for example, those under 15s, adolescents with disabilities, racial and ethnic minorities, and those living in conflict and fragile states. For adolescents who do survive pregnancy and childbirth, there's still significant risk of life-changing complications. Up to 65% of women with obstetric fistula develop this as adolescents, because often their bodies are not yet physically mature enough for labour, and they face additional barriers to accessing emergency obstetric care in many contexts. Health and rights are interlinked and interdependent, and never more so in sexual and reproductive health rights. A recent study from UNFPA found that only 55% of women are fully empowered to make their own choices over healthcare, contraception, and have the ability to say yes or no to sex. Ensuring girls and young women have access to comprehensive sexual and reproductive health services and are able to claim their rights is a fundamental part of achieving both gender equality and good health. So we're extremely pleased to see this firm commitment from the UK to boldly defend, progress and champion rights as part of this agenda. We also welcome the commitment to listen to, include and champion the voices and needs of marginalised and inadequately served groups throughout the UK's health agenda, meaningfully engaging young people in the design, implementation and accountability of services ensure they are truly responsive to adolescents in all their diversity. One example of this is Plan International's Young Health Programme, which operates in 9 countries globally, including in Kenya, where Hope was speaking from, to improve the long-term health and well-being of girls and boys. As part of this programme, young people carry out assessments of the local health facilities using a checklist developed with the Ministry of Health to help improve their provision for young people. In a recent assessment in Nairobi, it was found that while many of the facilities were able to offer free or affordable rates for young people, only half were open at youth-friendly times in the evenings or weekends. We're excited to see the key actions outlined in the approach paper. They present an ambitious agenda, which is needed now more than ever as the world continues to respond to COVID-19 and to reach towards the global goals of 2030. The UK has been a champion for SRHR, politically and financially, for many years. As the Foreign Secretary looks to increase funding for women and girls to pre-cut levels, a priority for this must be to commit to be spending a minimum of 500 million per year on effective funding of sexual and reproductive health services. Thank you.
Thank you very much, Rose, for stepping in and delivering those really powerful remarks and for making those links to other areas of policy, such as early and child marriage, forced marriage, sexual reproductive health and rights, and as you say, something that our ministers stand up for regularly in international fora. It sometimes feels like there's constant skirmishing around these rights issues to try and protect, defend and promote even women's rights in international fora. So we're very seized of that. Thank you. So thank you, Rose, and thank you to Sophie, Rebecca and Chris for all of their contributions. We're now going to move to the Q&A. As I said, you can pose, you can like questions. You know, we're not going to get to them all in the time we've got, but I promise you we will read them all, we will reflect on them all, and there is a plan for a session with our colleagues at Action for Global Health in the new year where we can follow up on any issues raised that we don't manage to get to, and we will try and get to through a broad range of issues. So that's going to be the approach. To get us started, we've had a question about partnership, and some of the panelists spoke about partnership. how we see the respective roles of FCDO, civil society, academia and the private sector driving this agenda. Sophie, I think I'd like to come to you on this, because you spoke about learning. I thought that was a powerful point. Health systems that learn, and academia helps us learn, one of the ways in which we learn. How do you see the partnership playing out between academia and the other actors?
Yeah, I think this is a really important area. And actually, just to highlight, there was a recent flagship report from the Alliance for Health Policy Research Systems for looking at learning health systems. So really highlighting that there's a key connection between the evidence that's generated, all the different levels of the system, creating a space for reflection by all the actors. So this includes obviously research community, but it goes way beyond that to all of the staff working in the health system, the managers, the all of the partnerships they have, including across the informal sector, private sector, and with external actors, donors, technical agencies. And then feeding that back into a kind of adaptive, agile health systems. So I think the learning function has really received a lot of attention recently and is great, and is expanded beyond a traditional focus on formal evidence generation, but really around how we use and empower actors to make changes at whatever part of the system they're sitting in, because they understand their context better than anybody else. So we play an important part in that as academics, but we don't own that space. At the same time, we obviously highly appreciate the support, and it has been really considerable support that's been provided over the years by DFID and now FCDO to the research community, and the importance that's been placed on rigorous analysis of what evidence can tell us. And as the Minister was highlighting, we do currently have a collaborative that's looking at better methods for evaluation of health system strengthening. It's been quite a challenging area historically, but all the international organisations, including FCDO, are on that agency, and we're bringing out a lot of new papers this year looking at better methods, better frameworks, better, clearer conceptualisation of this quite complex area. And so, yeah, really just to highlight that it as you say, it involves very strong partnerships, and we all play our role in it.
Thank you, Sophie. I'm really struck by your focus on the adaptive systems, and I remember from work on patient safety how important that learning is, what real impact it can have on outcomes for people, and the important contribution academia makes. Rose, I don't know if you want to comment on this issue of partnerships, how it looks from the civil society perspective, particularly around our ability to learn together as we build stronger systems.
Yeah, I think I'm hoping you can hear me, but I do think that partnerships are really critical to delivering in any of these aims. Particularly, I suppose I would look a little broader in partnerships, because it's really important that we have partnerships with the communities and young people that we hope to work with and serve. I think all too often they're not put at the centre of partnerships. And the other area that I think that we really need to look with, and I think this is something that we need to work closely with the ministries, the government, and with our donors on, is how we make the partnerships that we have with all the various players more equitable, in terms of really identifying the power dynamics within the relationships. And I think this is an area there where there's much learning still needed. And I think our funding and donor landscape does create an environment where our partnerships are not as equitable as they should be, which actually means that the long-term impact that we have is reduced. So I think there is great opportunity to improve our partnerships by really looking at the nature of these partnerships and learning how to make them more equitable and inclusive, with young people and communities involved, but also with other local civil society organisations. We know clearly that there are real challenges out there with local civil society who do know the context, who do know their environment they're working in much better than INGOs, and are very close to the ground on the work on the ground. So really important to bring that aspect to the forefront.
Thank you, Rose, for that focus on equitable partnerships, bringing in young people and the grassroots. Absolutely critical. Minister, I'm going to come to you in just a moment, because I think we've got a series of questions. The team are helping and collating, gathering some questions for us. I think, Beth, do you want to, from the chat, pull together a few questions that perhaps we'll go to the Minister on first?
Yes, thank you, Darren, and thank you, in fact, to all our participants. The questions are well and truly flowing now, quite a lot of comment there as well. So please do in particular keep liking questions that others have asked, so that we can make sure we're trying to get a balance here of both the most popular questions, the ones that mean the most to people, but also a range of questions that each of our panellists can speak to. And there is a risk here, of course, that we find that everything Minister Morton comes targeted at you. So we will attempt to spread the questions out a little bit in that respect. But I'm looking at the wall, I'm going to kind of identify two clusters of question areas that seem to be arising. There's a particular set of questions looking really at the links between global health security and these agendas here. And then perhaps predictably and very much understandably, a set of questions around the UK's financial commitment, both to ODA overall and various elements of the global health agenda. So two questions that Minister Morton, you might wish to start answering, but I'm pretty confident others in the panel will want to come in on. So Darren, I'll pass to you to think about that. But first of all, how can we ensure that countries and the world are better prepared to both deal with everyday epidemic diseases and be better prepared for the next pandemic, whatever that might be? And then, as I said, second, a cluster of questions around our financial commitments to various elements of the global health agenda, including, and I think I should name check these at this point, nutrition and malaria. So I think, Minister, there would be interest in hearing from you more about when the FCDO might be in a stronger position to, or when the government might be in a position to return to 0.7, and or when we, as the FCDO, might be in a position to make more financial and programming announcements as we look ahead. Thank you.
Minister, over to you, perhaps. So comments on those questions, and then I'll perhaps turn to Chris, give Chris notice on the pandemic preparedness in this agenda.
Yeah, there's quite a number of questions there, but maybe I should start my focus on some of the financial questions and cluster those together, and then I'll defer to expert Dr. Chris when it comes to pandemic preparedness. Look, I think when it comes to the financial landscape in which we're working, as I set out in my opening remarks, you know, we had to make some really tough choices when we made the shift from 0.7% to 2.5%, and the Chancellor has set out sort of the parameters for you know, when we would be able to go back to 0.7%. So I think there is, you know, as I said earlier, there is some the sort of the thinking sort of 2024 would be potentially that time. You know, but as I said, we have had to make some very tough decisions, and I know that has impacted right across the board in terms of the partners that we work with. Nutrition in particular was mentioned, and I'm guessing that that's probably in relation as well to the nutrition for growth summit. But I think it's important to you know, to recognise at the moment we are going through our spending review. But you know, in terms of nutrition for growth, I think specifically the timing of that in advance of our business planning exercise it's meant that we've not been able to make a financial pledge. But I think it's important to recognise that the UK spent £1.3 billion on global health this year, and that it does include programmes to prevent and treat malnutrition. And just to maybe share an example with you, the UK is delivering life-saving nutrition treatment for more than 100,000 malnourished children and 27,000 pregnant and new mothers in Ethiopia. And we've also helped to deliver food assistance and nutrition in Madagascar over the year as well. And if we take, the OECD data for 2020, the UK will be the third largest donor of ODA within the G7 as a percentage of GNI. And I'm keen that for all the tough decisions that we've had to make, it's important that we don't lose sight of that. So I hope that goes some way, Darren, to answering some of those questions around finance and around nutrition in particular.
Yes, thank you, Minister, and thank you for tackling that so directly and head on. We know it's of concern to many of our partners, and also the leadership you showed when you led us through that difficult period last year of implementing those decisions. I know partners appreciated the fact that you spoke to many of them personally. Chris, can I talk to you now about I'll ask you about the issue on pandemic preparedness and how this agenda can help make sure the world is better prepared for any future pandemic event.
Thank you, Darren. And absolutely, we need to be looking at this, as I said earlier. We need to be looking at what opportunities there are to strengthen our resilience to future health crises. We need to prepare for the next crisis, not the last one. The next crisis is not going to be the same as this pandemic, and we need to be ensuring that our instruments have the flexibility to be able to respond to the next health crisis, whatever it is. And it's doing things like investing in research and development in the critical technologies. It's putting in place the mechanisms that are able to flex and respond to crises in the future. It's the global collaborations, it's the treaties that we're establishing. And if we look previously at what we did following the Ebola crisis, it was some of these wider mechanisms that enabled us to respond to COVID. It was our investments in CEPI. It was the investments in the WHO blueprint for diseases, which included the disease X, which we're struggling with now. It was our R&D in epidemics across alongside Wellcome. But we're in the midst of an immense health crisis. But we know that the most vulnerable countries experience multiple crises, multiple epidemics all the times, and we can predict that for the most vulnerable countries it's not going to be one crisis, it's going to be multiple shocks in the coming years that actually we know are going to occur. It's not if, it is they will experience multiple shocks, whether that's economic shocks, whether it's epidemics, whether it's system crises. It is likely that these systems will experience multiple shocks, and we need to support them as they prepare for this. So what underpins this? And I know I talked about the buy one, get one free. Apologies for the cheap phrase. Health systems are fundamental. All of our interventions that we're delivering on COVID and the interventions which will be critical in responding to the next health crisis, whatever it is, rely on the strength and resilience of health systems, particularly in the most vulnerable countries. And so it is really underpinning. We can invest a huge amount in preparedness, in treaties, in R&D, but actually without the health systems to deliver these vaccines, these diagnostics, these therapeutics, actually these interventions won't have the impact. They need the health system, they need the health workers to deliver the vaccines, they need the financing for enable this to work. We need the instruments that health systems have. So it is health systems, strengthening health systems will prepare us for whatever crisis affects the individual countries next.
Thank you very much, Chris. I just wanted to add a word on what the Minister said about malaria in particular, because I know that we've had a comment in on that from one of our MP colleagues, and just to reassure colleagues that we are still a major player in the Global Fund, of course, which funds much malaria activity. We have provided support for R&D for new malaria vaccines. We've also made available through partners innovative financing to support the manufacturing and production of malaria vaccines, and now we're working with Gavi through the board to support the procurement and the deployment of those vaccines in appropriate settings. So malaria remains a key area of work and interest for us. I think, Mina, you're going to come in next with the next batch of questions for our panel.
Yeah, thanks very much. Thanks for this very interesting discussion. So there were 3 questions, predictably from me. One of them is around sexual reproductive health and rights, and our approach, the UK's approach to women and girls, and how that is going to incorporate sexual reproductive health and rights. How do we see that panning out? Another question was about research and development, our work, how we plan to work across Whitehall on research and development. There were questions about financial cuts in that space, but I think you've sort of answered the financial cuts questions in the last part. The third question is more broad, really. There's a lot in the chat around trade-offs between horizontal approaches and vertical approaches. When we focus on diseases versus focusing on the system, how do we handle those trade-offs? That's, you know, an age-old question, possibly a broader one for more panelists to answer. So that's it, 3 questions.
Thank you, Mina. Minister, perhaps I'll turn to you first to offer some reflections on that set of questions. Which bits would you like to take? And then we'll move. Perhaps, Rebecca, I'll come to you then next from a private sector perspective.
Thank you, Darren. I firstly really want to touch on the point about SRHR, because you know, we all know that the Foreign Secretary's got a real focus on women and girls, but when it comes to SRHR, I think the UK's got a very, very strong track record here. And as you were saying, Darren, when we were reflecting on some of the early questions and the discussion, in the SRHR space, I know this as a Minister for Global Health, the UK is very often a very, very strong and very, very passionate voice in an area that is very, very sensitive. And I think that's an important and critical role that we can and should and will continue to play. And, you know, an area where sometimes it's very difficult for others to be able to perhaps speak out as strongly as we, the UK, do with some of our other partners. So for me, that's really, really important, to making sure that women and girls have a voice when others perhaps aren't always as vocal as the UK. So I'm keen that we continue to do that, as well as, yes, there's a spending piece around that, but it's the voice for me is just as important. I think in terms of R&D, and personally, I think the UK's got a long, strong record in this field. Others on the panel might want to say a little bit more about the detail, Darren. Perhaps, I don't know. I'm looking at Chris with all your vast experience. But even if I think to the research and development that we've done in the COVID space, turn the clock back to the work, the funding that we've done with FIND, with CEPI, you know, the work that we did to get AstraZeneca vaccine there and available globally. And I think these have all been really important tools, but it's not just in the COVID space, it's in many, many other areas as well, as you know, Darren.
Thank you, Minister. Yes, and in our R&D, as I know Chris would say, we strive to get a balance there between our disease-specific investments and what we do on systems. And of course, the trick is to make sure our investments in disease-specific are delivering benefits for systems. that's how we approach many of our multilateral investments, trying to secure the win-win. But Chris, do you want to comment briefly? So Rebecca, I said I'd come to Rebecca next. Please, Rebecca.
Hi, thanks, Darren. I guess a couple of examples from the private sector, probably two areas to focus on. One is around economic opportunities and one upstream and downstream, and one is around stereotypes. So I think one of the biggest things that the private sector can do when it comes to gender is thinking about how do we improve, firstly, unfortunately, we still have to deal with this safety. For example, we've done a lot of work with UN Women on a global women's safety framework in rural spaces. So looking at how we can increase the safety for women in, for example, our agricultural value chain. So we're doing a lot of work in Kenya and in India through a Women's Safety Accelerator Fund with IDH to look at different structural interventions that we can make to ensure that women are better protected and they are not subjected to discrimination or to violence and sexual violence during the day-to-day work. And then I think on the economic opportunities, really ensuring that we can work to help, for example, female entrepreneurs who really struggle to develop business ideas. They face a lot of hurdles such as burden of unpaid care or domestic work, real lack of access into business work and skills training. So we've done a lot of work through things like a We Learn digital platform to help women entrepreneurs and aspiring entrepreneurs to get the right kind of business and digital skills to adapt in a changing world. And we've talked a lot about the impacts of COVID on that. Things like inclusive distribution models. We have a program which we've worked on for many years called Shakti, which is a global sales model. So we work with women in rural communities, train them up as distributors of Unilever brands, but not just to sell the products, also the message behind washing your hands with soap or brushing your teeth, ensuring that you're thinking about the health implications as well. And that's enabled us to reach really hard to reach areas, really isolated from sort of traditional opportunities. So lots of work there. Things like financial inclusion programs. We know that's a massive barrier to entry for women into getting a job. They don't, for example, in many countries have access to a bank account. So we've done a lot of work through the CEO partnership that was set up by the Dutch, by Queen Maxima in the Netherlands, working on financial inclusion. So, for example, we work with MasterCard in Kenya to provide interest-free credit to small-scale retailers. And most of the people that benefit from that program are women who wouldn't otherwise have been able to get access into the formal digital and financial economy. And then one other thing that we've done, which I sort of hesitated whether I should mention this or not because it's not directly around health, but I think it's really important, is around the power and reach of advertising. So, for example, we set up a group called the Unstereotype Alliance, which changes the way that gender is portrayed and perceived in advertising. And actually, we're one of the largest advertisers in the world. And we know when we do that, we can actually start to influence normative opinions and normative values in society, showing women, people from disadvantaged communities in leadership roles, for example, really trying to change the perception of how different parts of society are represented, and that in turn can have quite a powerful impact on how society then treats other people. So yeah, just a few different examples of areas where the private sector can make an intervention.
Thanks, Rebecca. That was really powerful. Actually, how you set out there, focus on women and girls, the right thing to do in itself, but also good for health outcomes, good for the economy, good for business, and really powerful examples. Thank you so much for that. Look, we've got we're really honoured to have Professor Charlotte Watts, our Chief Scientific Advisor, on the line. So why don't I just bring Charlotte for a super quick comment on our R&D and the R&D components of that question.
Great. Good morning, everybody. Fantastic session, and I've been really enjoying actually sitting in the background, just getting inspired by all of the presentations. Just to answer the question on R&D, just to say we work very closely with DHSC colleagues when we're thinking about that portfolio of health investments, and we're very much in those conversations, sort of working out, well, who does what, who's better placed to commission different aspects of research, but really looking at the complementarities and synergies. I think, but more broadly, when you look at this issue of preventable deaths, what's really striking, and that's from the discussion and actually the way we think about it, is what are the kind of core investments we're doing in health, you know, around the different drivers of maternal and child poor health, but also how do we get evidence around how do we tackle some of the structural drivers? And that evidence very much draws on investments that we're making across a range of our research portfolio. So along with our investments in health, our investments in gender, our investments in more nutritious crop varieties, our investments on how do you work and bring in and create opportunities for the most marginalised. So for me, what's very exciting when we're moving forward with this agenda is the breadth of evidence that we can draw on to really shape and inform our strategy and our diplomatic efforts.
Thank you very much, Charlotte. I think we're out of time for questions, sadly, but I've taken an enormous amount of encouragement from that as well. I'm looking forward to continuing the discussion with you all as we try to bring together our financial, development, diplomatic expertise in partnership with all of you on this really important agenda. We move now to sort of the last part of the event, and I'm really delighted to be able to welcome our Director General. But I think first, Ben, you're going to say a few words, aren't you?
Yes.
Okay, then we'll move.
Thanks so much. Thanks so much, Darren, and everyone. And it's just to say thank you for inviting me to say a few concluding remarks at the end of this panel session in my role as representing Action for Global Health members. For me, there's been a fantastic number of questions. I'm sort of full of admiration for FCDO colleagues who've been navigating them. The contribution of the panelists is exceptional. Strong praise for the papers is coming through. I was struck by various things, including the reference to the need for more equitable partnerships, and indeed perhaps we could have had a stronger low middle income country voice in this event. But I'd like to go back to the beginning, if I may, just by way of conclusion, and say these papers make for excellent reading. I again want to extend the congratulations of Action for Global Health Network to Minister Morton and to FCDO colleagues, and to thank her again for championing the thinking in these papers. There are important phrases that we've been hearing throughout this morning. Important, we can do all we can, says Chris Lewis. We need to be a partner when it's hard, says Minister Morton. We have to ask ourselves, are we passing the test? Are we doing all we can to bring alive the global solidarity that Dr. Tedros called for? COVID-19 is a devastation to human health and to our economies, but it is also a rehearsal. There will be more pandemics. Some, such as growing resistance to antimicrobials, are already with us. Climate crisis is already visiting untold damage across our planet. We need to prepare for the next crisis, as one of the speakers said. Health is global. We are in this together. We need to be good at this. We need to be good at working in solidarity. So the Minister is right to point to the considerable spend in UK aid, which continues. And as Darren says, we are still a major player in the Global Fund and in Gavi. Minister Morton quite rightly highlighted the research and development work in relation to COVID with AstraZeneca, for example, but it's not just, as you said, it's not just about that. But from an Action for Global Health perspective, and I think many of the participants, this must include a return to 0.7, as Professor Alan Whiteside wrote in the chat box. It is my view that until the UK meets the 0.7 goal, we lack credibility. So these papers are an important and exciting step forward in articulating the UK's contribution globally, and rightly warmly welcomed by everyone, I think, who's participated this morning. There is huge admiration for the work of the UK in development and appreciation of Minister Morton's championing of this. Much is being achieved. It is inspiring, as Charlotte Watts says, but so much more can be achieved and needs to be achieved if we are to get good at walking in solidarity with the rest of the world, and particularly those who are most vulnerable. So thank you so much on behalf of Action for Global Health for inviting us to co-host this meeting, and I pass back to you, Darren.
Thank you, Ben. We really look forward to continuing the conversation with you and colleagues. So we've launched today FCDO papers, but actually these are a government, a UK government kind of offer. They set out an approach we're going to take with all of our partners across government. And you'll know that we work closely with the Department of Health and Social Care, but with our Prime Minister's office, with DEFRA, as we take more of a One Health approach, with our colleagues in BEIS on research and climate and health issues, and of course with the Government Office of Science. So it's our privilege to pull it all together, but it's a real partnership across government as we reach out in broader partnership with you and other colleagues. So now I'm going to welcome our Director General, Vijay Rangarajan, as well as supporting us on global health. Vijay leads for FCDO on a range of issues: climate and environment, Americas, North and South, the UK's overseas territories, and our C19 broader response. He's extremely busy, and I'm really pleased he's been able to find some time to help us close the event today. Vijay, over to you.
Great, thank you, Darren. It's really good to see all of you, and a fascinating conversation, as Charlotte said, in which I, for one, have learned a lot. We're facing quite a big set of challenges, not just financial, but in the middle of a pandemic. And one particular, which I'll come back to at the end, which is broadening the number of partners that we have and how we work, not least given the spur of the pandemic, but other things as well, which make us give us opportunities, but it doesn't mean that the environment is what we can achieve, and keeping that level of ambition up, as Ben said, is truly important. I'm just going to introduce quickly two short videos I think we're having at the end. So the first is Dr. Abubakar Campo, Director of Health at UNICEF. He's going to, I think, give talking about the role that they play in ending preventable deaths of mothers, which, as the Minister said earlier, is very much one of the key things that FCDO is trying to do. So first video, and then we'll come back to Dr. Susanna Jakob, who is Deputy Director General of the WHO.
Esteemed colleagues, it is an honor to be part of this event. My name is Dr. Abubakar Campo. I am UNICEF's Global Health Director. UNICEF strongly welcomes this approach paper as a foundational step towards ending preventable deaths of women, children, and newborns. The COVID-19 pandemic has resulted in huge disruptions to essential and life-saving services, including routine immunization, nutrition, education, and social protection programs. I'm greeting you from Kabul, where I'm on joint mission with WHO, and it is ever more apparent that the poorest and most fragile countries continue to face the steepest challenges and are unable to cope with the direct and indirect impact of COVID-19. Health systems are being pushed towards breaking points. As a result, children's lives and future are at risk. But let's not forget, even before this pandemic turned out our world upside down, the burden of children's mortality represented an enormous loss of lives. In 2019, over 5 million children died before they reached the 5th birthday. Indeed, 2 years into the global pandemic, the official death toll from COVID-19 is still lower than the rate of children deaths we see every year. As the world races to vaccinate population against COVID-19 to save lives, we should recall that most child deaths are also preventable, many with routine childhood immunizations. But until every woman and child can access primary health care and the full range of vaccines, we won't get on track to end preventable deaths by 2030. To change this, we need progress in leveraging development and diplomacy. We need to prioritize mothers and children in all phases of the pandemic response and recovery. And we need to protect funding for mothers and children. This is important, especially in the face of economic hardship, and even more critical as the world continues to face protracted humanitarian crisis, where almost half of under 5 deaths occurred last year. We will not move the needle on child mortality if we cannot reach children in fragile and conflict-affected settings. The world has a lot of the answers on how we can end preventable deaths, but we need the political will and funding. Every child has the right to survive and thrive. But that fundamental right to health must be realized through political choice, one that also recognizes that investment in health are investments that yield great dividends in both social and economic development. With an exceptional track record of being at the forefront of progress across the global health agenda, the UK has a unique role to play in galvanizing global actions to end preventable deaths at this critical juncture. Delivering for mothers and children will create a stronger health system and a healthier world for all. We hope this paper will usher a new era of critical needed UK leadership and progress towards SDG 3.2. UNICEF and UNICEF UK stand ready to support and work with the UK government to advocate for what we know children need to survive, thrive, and fulfill their full potential. Thank you for listening.
John, should we give you a second to sort out the technicalities, and I'll just continue. I'm conscious of the time as well. And Minister, I think you're going to say some final words. I just want to say a couple of brief things at the end. One was just to return to this theme of partnership. We've got a lot of partners, not least as we're in the middle of and coming out of parts of a pandemic. An awful lot of organisations have really lent in and helped us cope with many of these issues. So I'm just struck with, obviously, working very closely with the UK Health Security Agency, with BAIS, with DHSC, with our colleagues in DEFRA, on One Health, given the zoonotic aspects of this, with Cabinet Office and so many across HMG, which is fantastic. We're going to have to build on that. Across the whole UK system as well, there is so much more we can do with the private sector, with so many who have lent in to help on the pandemic, but who are absolutely now part of strengthening our health systems, both domestically and internationally. And then, of course, all of you, and to say thank you all for being here. I think helping steer the very difficult decisions that we have to make on the balance of, are we going to work on systems in some countries? Are we working on particular diseases? And I think you already discussed malaria and polio and various others. How far do we invest on pandemic preparedness, as Ben and Chris have both said? What's the right investment balance between all of those for the right timescales is a really, truly complex set of decisions. We are strengthened by some fantastic new coalitions, not least the organisations set up, but as Chris and Darren and the Minister have said, building on the success of CEPI and Gavi and the Global Fund, of course we're going to do that. But there are new coalitions as well, both domestic and international, that I think we need to foster in order to really tackle not just the pandemic and pandemic preparedness, but so many of the other health challenges that we have faced. There's a kind of moment of some optimism that the technologies and the money and these coalitions can effect a real step change in how we tackle many global health issues. I couple that with new donors, and there are a number of new donors internationally, so coordinating with them and giving real help to them to enter this space where the UK has been for a long time, but also helping getting the maximum leverage that we can is going to be crucial. And finally, I just want to come back to a point that several have made, which is the resilience of our systems. We heard of this loud and clear at COP26 with a really successful set of meetings and discussions of the intersection of climate and health and resilience. And I think that is going to be, not least in the run-up to COP27 and during this year of our UK COP presidency, a really important strand of work to keep going. What I suggest we do is ask the Minister to finalise this, and then for those who can, it would be great to stay on and listen to Susanna's video. Minister, over to you.
Thank you, Vijay. I think you've done things that really well, and Ben gave us a great roundup as well. I think it's sitting here this morning. I have to say I've really enjoyed listening to the discussion, to the contributions, and also the questions that we've had. And I go away with a few sobering reflections, but a reminder of why this work is important, but also inspired by the many contributions that we've had. So I'd like to thank everybody for their time, their participation, but importantly for the partnership. I think this is going to be really important, partnership and working together, and for really reinforcing the critical importance of this agenda. So thank you to you all, but also thank you to Darren for chairing us and keeping us on track this morning. Thank you.
Dear colleagues, I am delighted to be here with you today at this launch event and wish you a happy UHC Day. I welcome the UK's efforts on health system strengthening, health security,
and ending preventable death of mothers, newborns and children, and recognise the UK's long-standing support to WHO. We have all witnessed the tragic consequences of the COVID-19 pandemic on individual lives and on our development goals. Catastrophic illness and death, over 100 million people pushed back into extreme poverty, and so many adverse effects, including on mental health, education, and access to critical health services. In this situation, we have recognized the centrality of strengthening health systems as the foundation to building greater health security and achieving UHC. It is clear that we must now refocus our efforts on the basics of health system strengthening, investing in essential public health functions, the health workforce, and primary health care. We need to tailor this to each country's needs and priorities, putting countries in the driver's seat to determine their own pathways and priorities, but we also need to work with and for the communities. It is only with strong health systems that we can move closer to universal health coverage and health security. And I want to acknowledge and thank the UK for its long-standing and invaluable support to WHO in this regard. I also applaud your focus on the critical work on ending preventable death of mothers, newborn babies, and children. We need to continue working together in partnership on health system strengthening and ending preventable death of mothers, newborns, and children. Now, more than ever, we must work together towards our SDG goals and use the global health architecture and key partnerships such as UHC 2030, the PMNCH, the UHC partnership to help move forward. WHO is dedicated to this collaboration and will continue to use its convening power to bring everyone on board. Thank you.
Marvellous. So we're over time. Let's wrap up. Thank you again to the Minister for joining us, and to Vijay as well. Thank you to all of our panelists for such fantastic interventions, and to our colleagues at Action for Global Health for the partnership making this event happen and getting these papers launched and out there into the world. And now we've got to set ourselves to the task of implementing them, of course. I hope you all feel as re-energized as I do. I hope it's not too early to wish you all a happy Christmas or a happy festive season, if that's more appropriate for you. And I'm really looking forward to building on our partnership as we head into next year and beyond, and achieve those really important things together. So thank you so much, and have a great rest of the day, everyone. Goodbye now.